Hello everyone, welcome to the channel. In this video, we will talk about the Government of India's latest nationwide program, Swasth Nari, Sashakt Parivar Abhiyaan. It is a joint initiative by the Ministry of Health and Family Welfare and the Women and Child Development. This campaign will be running from 17th of September to 2nd October 2025. So it is the largest ever health outreach for women and children in the country. During this, over 1 lakh health camp will be organized across various Ayushman Arogya Mandirs, community health centers, district hospital and other government health facilities. So the target group for this campaign are women, children and adolescent girls. And during this, screening services, preventive, promotive and curative services will be offered. So the program objectives include promotion of family well-being via maternal and child care. And there will be focus on maternal and child care to strengthen the family well-being by integrating these initiatives with Poshan 2.0. So in this, the antenatal checkups, counseling, distribution of MCP card will be done to monitor health progress. Second objective include foster behavior changes through education. Abhiyaan drives behavior changes by educating communities on essential health issues like menstrual hygiene, balanced nutrition, and overall wellness. So through the various workshops and awareness programs at the Anganwadis during Poshan Ma, this campaign empowers women with the knowledge to make informed health choices. Then also this Abhiyaan encourages community participation and public awareness. So it is promoting Jan Bhagidari Abhiyan, thereby encouraging involvement from private hospitals, local leaders and the citizen. Anemia detection and treatment, tuberculosis and sickle cell disease management, and maternal and child health services like prenatal care, immunization, nutrition, and focus will be on menstrual hygiene and mental health awareness. So the medical colleges, district hospitals, central government institutions, and the private hospital will be utilized for the specialist services like gynecology, pediatrics, eye, ENT, dental, and other departments. Along with that, the central government institutions such as AIMS, Railway Hospital, Defence Hospital, ESI Hospital, and other institute of national importance will also complement these efforts, ensuring a specialist services and the continuity of care to reach the last mile. And various several private sector health facilities will also join this initiative. Along with the screening of various diseases, the focus will also be on mobilizing community for obesity prevention, improved nutrition and voluntary at grassroots levels. Various workers will be utilized for the community mobilization like ASHA, ENM, Anganwadi workers, self-help groups, Panchayati Raj institutions, urban local bodies and various youth groups. Government is also focusing on maintaining a healthy lifestyle and wellness component during this campaign. So the focus will be on reducing the obesity with 10% reduction of sugar and edible oil, promotion of local and regional food, early childhood care and infant young child feeding practices, promotion of menstrual hygiene and nutrition, and distribution of take-home ration. The nutrition component is integrated with the celebration of Poshan Ma, and various recipe demonstrations, awareness on the balanced diet, reducing sugar, oil, and the use of seasonal and local foods will be promoted. The easing access to healthcare services component will be focusing on making the healthcare easily available to the women and children by linking them with various essential government health schemes and services. That includes the MCP card that ensures the record keeping of maternal and child health services, enrollment in Pradhan Mantri Matru Vandana Yojana for financial assistance during pregnancy and lactation, in Ayushman Vai Vandana card, It extends health insurance and benefit to eligible women, and there will be screening and identification of women at risk of sickle cell anemia, and there will be registration of various beneficiaries in the Poshan tracker that helps in the monitoring of nutritional support services, and it ensures that the benefit reach the intended women and children. Real time Sashakt Parivar Abhiyaan. That includes what is the importance of such a nationwide large scale initiative. As we know, the anemia in the women is high as 57% in India, very high prevalence of anemia. The burden of NCD is also rising, and it contributes to around 60% of mortality. Although the maternal mortality rate has been declined in various states, but it is still a challenge in many states. And the nutrition intervention we are doing, they have a lifelong benefit for both the mother as well as the child. And the preventive screening is very important to decrease the future burden of various diseases. Although this campaign is the need of an hour and it is one of the largest campaign organized by the government of India, but there are many challenges ahead as well. First is the follow-up care and the continuity. The patient who are being screened in the camps, what will be done for their follow-up, for their medication or the referrals. And second challenge may be the quality of services that will be affected by the training of personnel, the correct diagnosis, privacy, and the counseling services, which may vary from place to place. Other may be infrastructure constraint, like in rural or remote areas. The health center may lack the required specialist services or the diagnostic facilities. Other challenges include the regular supply of drugs, test kits, supplements, which will be required during screening and treatment. And challenge includes the cultural barriers and myth, low health literacy, which may affect the utilization of these services.